Hi, I'm Beth Manette with the Illinois SHIP, and I'm here to talk to you about understanding the basics of Medicare. What is Medicare? Medicare is a health program for people 65 years or older, people who are under 65 with certain disabilities, and people with end-stage renal disease, also known as ESRD. Medicare is administered by the Centers for Medicare and Medicaid Services, also known as CMS, and you are enrolled through the Social Security Administration or the Railroad Retirement Board. There are four parts to Medicare. There's Medicare Part A, which covers hospital insurance, which is the hospital insurance. Medicare Part B, which is medical insurance. Part A and B are also known as Original Medicare. There's also Medicare Part C, which is a Medicare Advantage plan, which encompasses HMOs, PPOs, private fee-for-services, and there's Medicare Part D, the prescription drug coverage. Social Security is responsible for the eligibility and enrollment into Medicare. Once again, people 65 years or older can get Medicare. You have to contribute to the Medicare program you have to pay into Social Security for at least 10 years, married a minimum of 10 years from a former spouse. If you're under 65 years old, you must be receiving Social Security, disability, or railroad benefits for at least 24 months. Also, at any age, if you're receiving renal dialysis, or if someone has ALS, also known as Lou Gehrig's disease. Medicare for disabled individuals, the definition of that is that you have the inability to work. Your disability is expected to last for 1 year or more, or your disability will result in your death. It can also be a result of blindness, and the requirements for blindness is that your vision is 20/200 or less. Social Security, once again, is responsible for making all disability determinations. To apply for Social Security disability, you would call Social Security at their 800 number, which is 800-772-1213. You would need documentation such as your Social Security number, your proof of your age. You'd also need to give your doctors and hospital names, medical records, your work history, your W-2 form. You should not wait to apply for disability. If you feel you are disabled, you should apply immediately with the Social Security Administration. Qualifying for Medicare, there is a 24-month waiting period, except if an individual has ALS. There is no waiting period for that. If someone is diagnosed with ALS, their Medicare begins the first month that their benefits begin. Individuals with a disability besides ALS, their Medicare would begin the 30th month after the disability began. They have a 5-month waiting period before their benefits begin, and then a 24-month period to wait for their Medicare. Automatic enrollment in Medicare would be after the 24 months. You would automatically receive your card, your Medicare card, in the mail from Social Security. Once you get your card, you must decide whether or not you wish to keep it, or you can also decline Medicare Part B. At that point, you would also decide whether or not you need to enroll in a Medicare Part D plan. ESRD disability for Medicare, that is for people who have end-stage renal disease. The coverage begins the 4th month that someone is on dialysis, the month you receive a kidney transplant, the month that someone is admitted to an approved hospital for the transplant or procedures preliminary to the transplant, or 2 months before the month of transplant if the transplant is going to be delayed more than 2 months. The Original Medicare plan, you can go to any provider that accepts Medicare. Once again, there's Part A, and Part A is free to most people. Others may be able to purchase it. You have to be a U.S. citizen or legal U.S. resident for 5 consecutive years. Part B, you may pay a monthly premium. Starting in 2007, some individuals have their premiums based on their taxable income. For Medicare Part A and B, there is a deductible and co-insurance or co-payment, which is determined on a yearly basis. This is what everyone's Medicare card will look like, the card. Medicare Part A, there are some of the covered benefits. Part A helps cover for inpatient hospital stays, skilled nursing facility, home health care, hospice care. Medicare Part B pays for doctors, the medical expenses. That would be physician services, some diagnostic testing. It also helps pay for home health care, outpatient hospital services, and durable medical equipment. Medicare Part B also covers preventive services, such as a Welcome to Medicare physical exam, which someone would have to have within the first 12 months of their entitlement to Part B. It also covers various services such as the flu shot, glaucoma testing, the pneumonia shot, mammograms, and various other preventative services. Services that are not covered under Part A, there's if hospitalizations beyond 150 days, custodial services, if someone is in a nursing home for just custodial care, that would not be covered by Medicare, skilled nursing facilities beyond 100 days, and full-time nursing care at home. Medicare Part B, such services that are not covered would be routine care, such as physicals, routine foot care, dental care, acupuncture. Basically, Medicare Part B does not cover routine care. And that would be the basics of understanding Medicare. The Medicare premiums are determined yearly. Currently in 2009, the premium for Medicare Part B is $96.40 for an average person, and the amounts vary depending on people's income. I hope you enjoyed the understanding the basics of Medicare.